Here's a situation families don't always plan for. Someone you love is recovering from surgery, dealing with a chronic condition, getting older, or simply finding everyday tasks more difficult than they used to be. And suddenly, the question isn't just, what care do they need? It's, can we help them get that care without making them leave the place they call home? That's where home care can become incredibly valuable. But finding the right service can be confusing. There are different types of home-based care, different levels of support, different schedules, and different costs to consider. Welcome to Review Remedy by ScoreDoc, where we turn healthcare research into practical information you can actually use. Today, we're looking at 5 best home healthcare services in Dallas, Texas in 2026, according to ScoreDoc. And we'll go beyond simply naming the services. We'll talk about what to look for, what questions families should ask, and how to figure out which option actually fits your situation.
And before we get to the list, there's an important distinction worth making. Home health care and non-medical home care aren't necessarily the same thing. Some home-based services focus on assistance with everyday activities such as bathing, dressing, meal preparation, companionship, or mobility. Home health services can involve skilled health care provided under appropriate clinical direction, depending on the patient's needs and eligibility. So before choosing a provider, first determine what type of care your loved one actually needs. That one step can save you a lot of time and prevent you from choosing a service that isn't designed for your situation.
Let's start with at-home personal care. For families looking for assistance that helps someone remain comfortable and independent at home, this is one of the Dallas area services worth researching. When evaluating personal care, don't just ask, can someone come to the house? Ask something more specific. What exactly will the caregiver help with? Will they assist with daily routines, meal preparation, personal care, companionship, mobility? Getting specific about the tasks your loved one needs help with makes it much easier to determine whether a service is actually a good fit.
Next is Guiding Home Care, Inc. For families considering home-based support, one of the most important factors is consistency. If a loved one depends on assistance every morning, for example, reliability isn't a luxury, it's part of the care plan. So, when speaking with a provider, ask about caregiver scheduling, backup coverage, communication with family members, and what happens if the regular caregiver is unavailable. Those questions may not sound exciting, but they're the questions that become very important 6 weeks into a care arrangement.
Our third featured service is Home Helpers Home Care of Dallas, Texas. For families comparing home care providers, this is another option to put on your research list. Here's a useful approach before you even make the phone call. Write down your loved one's 3 biggest daily challenges. Maybe it's getting dressed. Maybe it's preparing meals. Maybe it's safely moving around the house. Or perhaps the biggest issue is simply being alone for long periods. Once you have those priorities written down, you can ask each provider the exact same questions. That makes comparing services much easier and much less subjective.
Number 4 is Right at Home. When evaluating a larger home care service, families should pay close attention to communication. Who do you call when there's a problem? How are care changes communicated? How quickly can the schedule be adjusted if your loved one's needs change? And importantly, how involved can family members be in the care plan? Home care isn't only about the caregiver and the patient. For many families, it's a 3-way relationship between the person receiving care, the caregiver, and the family coordinating everything behind the scenes. Good communication keeps that relationship working.
And our 5th featured service is Stay-In Home Care. For someone who strongly prefers remaining in familiar surroundings, home-based assistance can offer something that a facility simply can't replicate: the comfort of home. But comfort should never come at the expense of safety. Before arranging care, take a quick look around the house. Are there loose rugs? Poor lighting, stairs without secure railings, a bathroom that could use grab bars? Sometimes, improving the home environment alongside arranging professional care can make a significant difference in day-to-day safety.
So, you've got 5 services to research. How do you actually choose? Start with needs, not names. Ask, what kind of care does my loved one actually need? Is the need medical, personal, or companionship focused? How many hours of support are necessary? Is overnight care required? How quickly can care begin? What happens if a caregiver calls out? How are caregivers screened and trained? How does the provider communicate with family members? What will insurance cover, and what will we pay ourselves? And here's a big one. Ask for a written explanation of the services and costs. Don't rely solely on a verbal estimate.
There's another conversation families sometimes avoid. Ask your loved one what they actually want. If they're capable of participating in the decision, involve them. Do they want someone coming every day? Would they prefer help only in the mornings? Are they comfortable with assistance with personal care? Would they rather have a caregiver who comes at a particular time? Home care works best when it supports someone's independence, rather than making them feel like they've lost it.
And remember, home care needs can change. Someone may initially need help with meals and transportation. After surgery, they might temporarily need much more support. Later, their needs may decrease again. So don't just ask a provider, "Can you meet our needs today?" Ask, "What happens if those needs change?" That answer can tell you a lot about whether the service is suitable for the long term.
If you're researching home care in Dallas, the complete ScoreDoc guide can help you explore today's 5 featured services and continue your comparison. The link is in today's show notes. And if you're making this decision for a parent, spouse, grandparent, or another loved one, remember this. You don't have to figure everything out in one phone call. Start with their needs, ask clear questions, compare your options, and make the decision together whenever possible. Thank you for joining us for another episode of Review Remedy. Until next time, good care isn't just about where someone receives it. It's about finding the right support for the life they want to continue living.